is gone.
Yeah. No, I absolutely get it. Thank you for bringing it up. We'll try to see if we can get an answer here before
Is the city council or the commission, the current one, have they voted or taken a position on whether or not they want
turn
this
it
or
back.
don't? Because it, I mean, if there was a position taken, that's something that we could forward to the federal official. I mean, if the locals don't want the money, I mean, that's the whole point behind grants, theoretically. If the locals don't want it, and there is a match, of course, but if they don't want it, the idea is you're not supposed
Giving
to
it back
get it.
shouldn't be a problem. It's
But-
just we would need something
But
official.
but if at some point in the past the locals said they wanted it, that's what the federal government, the people who dole out the grants, which is
And in the 70s, we still had Hallmark there. We still had industries that were coming in.
Yeah. Unfortunately, yeah, the landscape's changed a little bit
Right.
here as far as
Yeah, current time, we've lost 39 businesses in Osage City,
Oh,
with
wow.
empty buildings.
Yeah.
Well, recently, the FAA was cut off from some of those
Right.
funds, okay. And I thought they were gonna make an exclusion and not put in those 13 rural airports, which I'm sure we would have been in that group. And if they're going ahead with the construction projects that have already started, that's one thing. But to start some of these
Right.
little insane ideas, how ridiculous is it?
Right.
Most of our areas here would rather have a post office.
Right. Then, yeah, the added cost, yeah, that won't be used.
There's, what money would go into the community, into Osage County and the surrounding counties, would be nice to begin with. But then it's the maintenance, it's the upkeep, maintenance, and personnel payment.
I get it. Okay.
A lot of
Yeah,
taxes
that
people don't need.
makes sense, yeah.
I'm all for keeping our airport, that we have one.
Okay.
And I think most of the people in Osage County
Just
would
not
agree with that.
lengthening, just,
Well, is it the time to do it? The larger airports that the FAA were, funding for a while, like for a week or 2 weeks or 3, those were already in the planning stage. They've already started construction. They should have that funding because instead of putting 10,000 people on unemployment. But we haven't started that process yet.
right.
So,
Okay, excellent. Well, like I said, usually the hard part for me is when people ask for money and I say, sorry, we don't have any. Rarely am I asked to give money back, and so this will be, this should be the easy part.
Next Congressman, we used to have a surplus in our treasury.
At the federal level, or are you talking about
Locally.
locally? Okay,
And now we are in debt like everything else is.
yeah. Yeah, and this would just be an additional.
You're being an accountant, you ought to be able to read an annual report pretty well.
I'm well aware of the red ink around the state and the nation right now.
Yeah.
So,
But we've already spent some of that money.
of course.
And I'm for paying it back and washing it away.
Okay.
And I think some of the new city commissioners feel that way.
All right.
See, they had this outfit out of Omaha, Nebraska, to come out to buy all this land and everything for the city. And I have some pretty valuable land. And if it was an industry, I'd give it to them. But it isn't.
All right. Excellent. What else? That's a great one. Yeah.
Can we talk about Social Security? Sure. I see it's here, 20% of the federal budget
Right.
is Social Security. That tells me that all the money that's being paid in by all the workers is going into the general budget, and that should never be, it should never have happened.
Right.
And there was an excellent article in the recent AARP magazine. I knew some of this, some of it I didn't. 64% goes to retired workers, 15% goes to disabled workers, 8% goes to widowers, and parents. I want to ask you about that. 8% goes to children, 5% goes to spouses, and I know about that, and that is not right, because a woman who has never worked or work very little can draw half of what her husband draws even while he is living. Now that's like somebody taking out of my savings account for somebody who never had to work, but yet she gets to dip into my savings account. I think that's wrong. I think we need to get it back to a trust fund so that the workers' money goes into that, and all these other, a lot of these other things can be an entitlement, if you wish. And that would help both situations.
That would, yeah, and I don't disagree. We really do need to make it a trust
Is
fund again.
anybody even thinking along those lines, working toward those lines or anything? Because it's completely out of hand. And what's the parents' deal?
Yeah.
What's this parents' deal? Do you know? Because I don't know. I hadn't heard about that.
Yeah, I don't know if
Are you
a
talking
child
about? Are you talking
dies.
about the parents of a lost lost child?
I don't know.
If they
It's in
were
there.
receiving, if the child in the family was receiving Social Security for some reason, and the recipient dies, they just like a widower, or the example that you had talked about, how they get a portion. The full payment stops, but they still keep getting a portion of that. It's very similar to that.
But you're
Why
right.
was that ever put in there?
Right.
Right. No.
If their
I agree.
parents are- They probably are getting Social Security if they're indigent.
No, I think you bring up some excellent points, and certainly it wasn't politically expedient to tee up a discussion about Social Security, Medicare, and Medicaid, but we did that during our debate on the budget earlier this year, and that's where you heard us all say, if you're 55 and above, we will make no changes to those folks because you've worked all your life anticipating these are the rules. You can't change the rules and break promises to people that have been planning all their life for that. But certainly those of us that are just pushing 50 have a little time to react. Certainly there is reason for us to address some of the things that you just brought up and shore it up so that it will be there for these kids, because like in the case of Medicare, in 8 years, it's bankrupt. It's gone if we don't do something about it.
But the system, the whole program needs to be revamped.
And that's what we were doing. Like I said, it wasn't politically expedient to talk about it, but it has to. I mean, if you're going to be a realist, if anybody wants to have it for the next generation, we have to talk about it. And I'm confident that we will have the Senate at least come along and have that debate at some point before this Congress ends. It hasn't happened yet, but certainly the House is trying, and I bet those things are all on the table, but we'll make sure that they...
I hope so, because this 20% is ridiculous. And the money going into the general treasury
Yeah,
just begs to be spent.
right. And it has been that and a whole lot more.
Right.
Yeah.
Well, I'm one of those wives that drew off my husband, and I worked side by side, elbow to elbow with him in the grocery store for 24 years, but it made more sense to turn all of the income in under his name
Oh, I see.
because
Yeah.
100% of not very much beat 50% of a heck of a small amount. And
So
these
that's
wives
maybe the
have been home.
history.
They've been home. That husband might not have been able to have that job if there wasn't a wife at home to entertain the boss or the corporate executives when they came to town, or keep the shirts pressed.
Then we need to keep those things in mind and just hear both sides before we make any changes. To make it easier, I mean, what we've been talking about is fundamental tax reform to try to simplify this mess. We shouldn't be spending the resources that we all do filing our income tax or our payroll tax. The system is just too confusing. I mean, if you have to, just for simplicity, file it under one spouse or the other, obviously the system's too confusing. So hopefully that can all be done as one package where we can reform the system, make it simpler. I mean, if it's just a matter of giving both spouses credit for 50%, then that solves the problem you were talking about. So,
But it doesn't work out that way, because he would draw everything that he is entitled to under that income level.
Well,
And
but
then she would
which-
get 50% of that.
And I'm
But
suggesting you
that's
take
more than
away,
a working couple who each pay in. She only gets what she,
I guess that's what I'm suggesting, is
Yeah.
you would take away the extra and just report it 50/50.
exactly,
And that you pull out what you put in, yeah, and eliminate the, yeah,
exactly.
yeah. Who else? Yeah,
Oh, Lynn, I read an article from, he's a lawyer in Texas, and he did a deal on this healthcare that was put in. He's a constitutional lawyer, and he's practiced for 30 to 40 years, and he read that entire bill through, and I read it on the internet, I got an email from it, and there was like over 176 different instances in there that this healthcare bill directly is against the Constitution of the United States. What I don't understand is why aren't the states suing the government over this healthcare bill?
50% of them are, or more.
Well,
It's in the courts right now, and really, you know, the constitutional experts, I'm not an attorney, but I talk to, say there's about a 50% chance that it could be ruled unconstitutional. And it really, the majority of it, I think, hinges on this individual mandate. You know, you can't make people, you know, and they can't buy groceries or medicine.
Yeah,
You can't
I
make people
understand,
go.
yeah.
So I think that, but if that goes, even if that piece, I think the whole thing unravels, and we have an opportunity to start over and do it. You know, of course, I was opposed to the way we did that and voted against it. I think there's a better way, and so, you know, my hope is that we'll get that chance to do it.
well, they talk about trying to cure the healthcare and your Social Security. One thing that's a direct burden on our Social Security and healthcare right now is all the illegals we have in the United States. There's a tremendous amount of the Social Security money is spent on building housing for them, they get free medical and everything. And it runs into the billions of dollars. And another thing, if you were to put all of the representatives, council, you know, all people in government to be on the same health care and Social Security as the people that have, that's all we got. They got their own private deal. Take away their private health care and Social Security and their security plan and put them on Social Security, and they'd say, hey, well, this isn't very good. They would do something about it.
Well, we are, I don't know at what point that changed, but now we're on Social Security. Does anybody know the history?
I think
How
it was
long?
the 80s.
The 80s. So that has changed
So
over.
there's-
But certainly that was brought to light last year during this healthcare debate, because when they drafted it, they wanted to carve members of Congress out and didn't want to make them go with everybody else. And that is one minor victory. We threw such a fit. They put us in with everybody else. The only people now that have a sweetheart deal are the president and the cabinet members. They are the ones that are.
They shouldn't have it either.
I know. I agree.
About Medicare, I got a lot of history about Medicare. My mother, 97 years old, passed on overdose City. She takes less pills than I do. Her health is real good. She's getting older, 97. Her hearing's bad and her eyesight's bad. But, you know, to give her rehab to keep her walking, everything. Okay, to keep the rehab paid, the rest home has to have me take her to the doctor every 30 days, or they don't pay. It's useless. Take her out in this heat, and that's $200 or $300 to the doctor comes in, they take her temperature, say you look fine, go home. Now there's a waste.
That's a good
15, 20 years
example.
ago, I was a power of attorney for my uncle in the hospital. Same old crap like that.
Okay. Well, that needs to-
Waste.
That needs to be included in our Medicare reforms, and like I said, it has to happen because it's bankrupt in 8 years. So while we're doing
If
it,
there's anything
let's.
wrong with her, we'd take her. I mean, it'd be
Yeah.
legally, she'd be in the hospital with the doctor.
Yeah.
But this is,
If anyone has car windows down, might just
it's rain and rain.
Good.
Get ready.
Blessed be, blessed be.
That's right. Good point.
I'm gonna go stop it, I'm gonna go roll my nut.
Okay, okay.
I will be 61 soon. And I am one of the working uninsured, okay? every time